Welcome to Proposers Day for Brains, brain repair for any injured neural structure, ARPA-H's newest innovative solutions opening, ISO. Today is your opportunity to learn what we're trying to achieve with brains and how to engage with ARPA-H as a potential partner. In this webinar, we will provide information on 3 points. 1, a short primer on ARPA-H. 2, what we are looking for with brains. And 3, how ARPA-H partners with outside entities to get revolutionary work done. First, what is the ARPA-H model? Advanced Research Project Agencies, ARPAs, are unique in their ambitious goals and modes of operation. DARPA is the best known ARPA, which you may have heard of. They did amazing things like develop the internet, autonomous vehicles, and stealth technology, for example. ARPA-H, where the H stands for health, seeks new technologies that will radically change healthcare for the better. The specific goals that ARPA-H aims to achieve, as for other ARPAs, at first glance typically appear impossible, underscoring our mission of taking on major rather than incremental advances in technology. The visions for taking major technological leaps comes from the program managers who are empowered with remarkable autonomy in the pursuit of their chosen mission, which is counterbalanced by their limited 3 to 6 year terms, ensuring inflow of new ideas into ARPA-H. This means that ARPA-H's portfolio is a reflection of its program managers, is dynamic, and changes frequently. Program managers join with their vision and launch programs that last 2 to 5 years, in most cases continuing beyond the program manager's time at ARPA-H. Success for ARPA-H is defined by real-world impact. Okay, let's move to the second part of the webinar, the brain's exploratory topic. Unlike programs, which are larger efforts aimed at going from revolutionary technical innovation all the way to implementation in the clinic, or unlike projects which stem from teams outside ARPA-H with a great idea to change the healthcare world, exploratory topics, like brains, are aimed at identifying and encouraging new performers to initiate smaller scale efforts that can then provide the foundation for a full-scale program. Okay, let's dive in. Brain damage is typically considered permanent because the brain has limited, if any, capacity on its own for self-repair. The brain's exploratory topic aims to take the first steps in developing advanced technologies for repairing damage to any of a number of brain structures. The ultimate goal is full reversal of brain damage, eventually allowing individuals to resume normal lives. Damage to the brain can result from many different diseases and occurs in many different structures. We've probably all heard about the irreversible loss of dopaminergic neurons in the substantia nigra, resulting in Parkinson's. But there are many other degenerative diseases that affect other parts of the brain, for which a few examples are given here. Importantly, all parts of the brain are vulnerable to damage from aging, strokes, injuries, toxins, and infections. All of these typically affect whole tissues, not just one cell type. Currently, therapies for patients with brain damage are confined to occupational, physical, and other forms of compensatory treatments that only benefit a fraction of patients, allowing them to recover only partial function. Family members, who are often the caretakers, shoulder much of the burden along with healthcare workers. The overall direct costs of care for individuals with any form of brain damage, along with the indirect economic costs, amount to an estimated $1 trillion a year in the US. BRAIN aims to take early, essential steps in bringing us to a world where patients with what is currently considered permanent brain damage can reacquire function and return to normal lives, where relief is provided to families, other caregivers, and the healthcare system as a whole, where one-time treatments reduce the overall costs of care, and where a new medical industry focused on brain repair emerges. Today, there are no suitable methods to functionally replace damaged brain tissue. There are examples of successful cell-based repair in clinical trials, for example, dopaminergic cells for Parkinson's and interneurons for epilepsy, but we are aiming for tissue-level repair, not single-cell type repair. The best we have in terms of precursor tissues are abnormally shaped organoids for some brain areas. These lack cell types, normal cytoarchitecture, and functional vasculature. And because of these abnormalities, organoids in their current state are not fit for purpose. The primary enabler in achieving our mission of functional brain tissue replacement is that we have a blueprint, which is the normal developmental process that gave rise to all the brain structures currently in our skulls. We also know from countless developmental neurobiology studies that deviations from the normal developmental process invariably leads to dysfunction. So if you remember just one thing from this webinar, it's this. With brains, we're aiming to recreate as faithfully as possible the same developmental program that originally built a given brain structure, but to do it in the adult brain, at the right place, with the right cell types, architecture, and maturation sequence. So enabling technologies here include omics of developing brain areas, including single-cell transcriptomics, spatial transcriptomics, proteomics, and others that will contribute to a high-resolution characterization of the cell types, their contacts, tissue cytoarchitecture, and extracellular components. In creating precursor tissues, machine learning approaches could also help in optimizing reproducibility and scaling of procedures. Surgical advances allow for greater, less invasive access to deeper brain structures. And brains is also based on the robust and reproducible finding across adult brain structures that the transplantation of neuronal precursor cells, or immature neurons, leads to remarkably good efferent and afferent connectivity with the rest of the brain. So taken together, these advances make it possible to specify the right cells, generate the right precursor tissue, deliver it safely, and have it integrate with host circuitry, putting functional repair of diverse brain structures within reach. The impact of brains, I'll summarize here, will be the development of technologies that will restore function to several parts of the brain, in the end providing relief for the first time to patients with brain damage, their families, the healthcare system, while creating a new brain repair industry. It's worth contrasting brains, an exploratory topic, with FRONT, a larger previously released program. There are several key differences between brains and FRONT. FRONT is focused exclusively on repairing neocortical tissue, while brains is focused on all other parts of the brain. And it is up to the performing team to choose one or two non-neocortical brain structures. FRONT takes neocortical tissue repair all the way to clinical readiness in 5 years, while brains in 18 months establishes early proof of concepts for future IND-enabling studies. FRONT leverages an already deep knowledge of neocortical development, cellular structure, wiring, and derivation of its cell types from human-induced pluripotent stem cells, whereas our knowledge of these areas for other parts of the brain is less mature. For FRONT, the neocortex is easier to access surgically than other parts of the brain. Importantly, the commonality between FRONT and brains is that both efforts will need to recapitulate as much as possible the precise developmental processes that gave rise to individual brain structures. Failure to do so will most likely result in non-functional tissue, and our goal is to restore function. Brains has two technical areas, or TAs. One, generate precursor tissue for one or more non-neocortical brain structures selected by the performer. And two, provide proof of concept for engraftment using donor non-human fetal tissue into an adult conspecific brain. Brains is an 18-month effort split into 2 phases. In the first phase, TA1 will achieve detailed specs for the desired precursor tissue, establish protocols for obtaining all cell types from human-induced pluripotent stem cells, and outline a detailed plan to generate a normally structured precursor tissue with all its cell types. Also in the first phase, TA2 will develop the surgical methodology for transplantation. Then in phase 2, TA1 will produce precursor tissue for at least one brain structure, and TA2 will achieve efficient graft integration with the host, both vascularly and neuronally. Potential performers can propose to tackle TA1, TA2, or both. At the 9-month point, teams will be evaluated on their progress, and a decision will be made whether to continue on to phase 2. Here's some additional guidance. Please note that more information will be provided through our website and can also be obtained by emailing us at brains@arpa-h.gov, where we will post responses as appropriate in a publicly accessible facts page. A follow-up session will be organized featuring a live Q&A period with the government team and contracting experts, as well as the opportunity for an up to 10-minute private one-on-one sidebar meeting between ARPA-H team and any potential proposer. A limited number of sidebar meetings will be available to participants, and sidebar meetings must be scheduled via the registration website. ARPA-H will collect participant questions throughout the event and publish answers to a publicly available facts section of the BRAINS website, as well as on sam.gov. The funding amounts are $500K per phase for each TA for each team submitting. Final take home, please, please, please read the Innovation Solutions Opening, or ISO, carefully. Within it are not so much suggestions as requirements for contracting. We're looking for teams ready to bring deep, brain structure-specific expertise in developmental biology, tissue engineering, surgery, and circuit integration to make functional brain repair a practical reality. We're ready and hope you are too. Before I pass the reins off to ARPA-H's Agreements and Contracting Officer to describe the nature of the agreements with ARPA-H, I want to thank you for your time and for considering partnering with ARPA-H on BRAINS.
Okay, I'm Georgina Perry, an Agreement Officer under the Business Innovation Division, Health Science Futures Mission Office, supporting Jean and the BRAINS Exploratory Topics program. The purpose of this portion of the presentation is to provide you with an overview of the contractual requirements of the Innovative Solutions Opening, also known as an ISO. The ISO was selected as the solicitation vehicle for this program, as ARPA-H does not intend to negotiate FAR-based procurements. ARPA-H is seeking opportunity to invite and encourage solutions from the industry that has typically shied away from working with the government due to the often viewed heavily restrictive terms and conditions. And ISO allows an opportunity for the government to weigh merit-based and technical quality over price. And ISO allows for best ideas to be considered. ISOs are flexible and allow for a variety of award instruments to be considered and negotiated. Some of the key highlights of the ISO is that all awards will be other transactions, and all non-government entities types are encouraged to participate on a proposing team. Unlike other ISOs, the BRAINS ISO will be providing you with a budget. For phase 1, awards are expected not to exceed $500K per team, with the possibility of an additional $5K per team for phase 2 per TA. Solution summaries are mandatory, and the government may only consider those submitted by the submission date and deadline. Proposers who submit a solution summary may submit a full proposal regardless of whether the government encouraged submission or not. The government does not anticipate reviewing non-conforming solution summaries or evaluating non-conforming proposals. We do request that you fully read the ISO and that you ask any questions prior to submitting your solution summary or full proposal. Award types under this ISO, once again, will only be other transactions. Other transactions are agreements, similar to a contract where there is an offer, acceptance, consideration, and legality. Other transactions are designed to reflect commercial contracting practices rather than traditional federal procurement contracts or financial assistance awards. There's an expectation that there'll be an increased collaboration and partnership, leading to more effective use of resources and knowledge between both parties, both the government and the awardee. This includes substantial involvement from the federal agency that may be ongoing throughout the project. Other transactions are flexible. Many contract laws and regulations that are typically seen in FAR-based procurements do not apply, such as SECA, FAR, and CAS. Other transactions are free-flowing and allow for negotiations to be conducted, which are less restrictive than FAR-based procurements and financial assistance agreements. Under an OT, the terms and conditions may be fully negotiated, including data rights and patents. Both parties are responsible for achieving the agreed upon outcome, progress, and results. Eligibility information. Who can apply? All responsible sources capable of meeting the government needs are eligible. Commercial performance, academia, nonprofit organizations, small businesses, and other non-small businesses are encouraged to propose. Number of awards. ARPA-H may make more than 3 awards to a single entity under certain circumstances. All proposals will be fairly considered, regardless of perceived limitations. However, there are some restrictions as to who may be eligible for an award. Under Section 3.1.1, if you are currently a government entity, such as a federally funded research and development center, or any other government entity, you are not allowed to participate as a prime or sub. However, exceptions may be made if you are able to offer unique capabilities. In those scenarios, we do ask that you email us directly at brains@arpah.gov. SAM registration is required for all performers and awardees. All proposers must have active registration in SAM.gov. Principal investigator is considered the key personnel, and they are not required to have an active SAM registration. However, we would be looking for any exclusions that may be identified under SAM.gov. Not all sub-awardees are required to have a SAM registration. We're primarily looking for the prime awardee to be registered in SAM.gov and to be eligible for an award under SAM.gov. Non-US entities, we ask that you review the ISO section 3.1.3. For non-US entities, ARPA-H will prioritize awards to entities that will conduct funded work in the United States. Non-US entities may participate to the extent that participants comply with any necessary non-disclosure agreements, security regulations, export control laws, and other governing statutes applicable under the circumstances. Awards will not be made to entities from covered foreign countries, foreign entities of concern, individuals currently involved or in an agreement with the malign foreign talent recruitment program, entities suspended or debarred from government business. Solution submission and selection process overview. Please see ISO section 4 and 5. Solution summaries. Solution summaries are mandatory. The length for the solution summary is not to exceed 3 pages. This excludes the cover page, the ROM, team qualifications and references. Additional guidance is provided in section 4 of the ISO. Appendix A is a requirement, so we ask that you please review Appendix A prior to submitting your solution summary. The solution summary is subject to review within the context of the evaluation criteria. All eligible submissions will be received by the solution summary deadline will receive a response. Full proposals only eligible if following a solution summary submission. Since the solution summary is a mandatory submission, only those that submit the mandatory solution summary will be considered for the full proposal. And this includes the parties that may have been discouraged from submitting a full proposal. For full proposal, you must follow the guidance provided in Appendix B. This includes the submission of the templates provided with volumes 1 through 3. For example, cost proposal worksheet, the draft OT with red lines, the administrative and national policy documents. The full proposal will be evaluated against criteria 1 through 3. Okay, some of the key highlights of the ISO and the evaluation process. Solution summaries and full proposals will be independently reviewed and evaluated, will not be compared with each other. Each step, including notifications, will occur as quickly as possible. The process is crafted to reflect the urgency of this program and to reflect the effort and time it takes to draft and evaluate for proposals. The evaluation criteria is listed in the descending order of importance. This includes criteria number 1, which is the overall scientific and technical merits, which includes innovative, feasible, and achievable tasks to be completed, an outcome that achieves the expected goals. Technical risk identification with the feasible mitigation strategy. Criteria number 2 is the proposer's capabilities or related experience. This includes the team experience, and expertise, experience in managing similar efforts to that is being proposed, ability to deliver the proposed technical solution and manage cost and schedule. Criteria number 3 is the potential contribution and relevance to the ARPA-H mission. This includes future application, including unmet needs within the biomedicine, potential for interdisciplinary approaches, understanding of direct needs and benefits for the stakeholders. Criteria number 4 is the assessment of proposed cost and price. Price analysis will be performed to assess the reasonableness and the value of the overall proposed price. Cost realism may also be performed. The evaluation process and checklist. So once again, step 1 will be the solution summary. This should include the cover page, solution summary, which is Appendix A, in the rough order of magnitude. At this stage, you will either be encouraged or discouraged to submit a proposal. If you are encouraged and you proceed to step 2, that'll be the full proposal. You will be submitting a volume 1 technical management proposal, including Appendix B, task description document, volume 2 price proposal, including proposal spreadsheet, volume 3 administrative and policy documents. After your proposal has been evaluated in step 2, you'll be notified if you've been selected for negotiations. If you are selected for negotiations, during step 3, we will be asking for either revised or additional documentation in order for us to be able to finalize the award. This includes negotiation of terms and conditions, including negotiating patent rights and IP rights. The final guidance. The final ISO is binding unless changes are posted to SAMS.gov via an amendment. We ask that you ask questions to brains@arpa-h.gov after checking posted questions and answers on the frequently asked questions website. Frequently asked questions are posted on the Brains program page and updated frequently. The government does not intend to respond to inquiries via email, posting responses to questions on SAMS.gov and Brains frequently asked questions as appropriate. We request that you register and update your registration in SAMS.gov and that you maintain registration in ARPA-H solution submission portal as early as possible if you intend on submitting a solution summary or full proposal. Once again, we ask that you read the ISO thoroughly, and any changes made to the ISO will be formally posted to SAMS.gov. I want to thank you for listening to today's webinar regarding the BRAINS program. We do encourage you to ask questions as necessary, and we look forward to receiving your solution summary and subsequent full proposal in the future.